Hi everyone, welcome to my channel. I am Nafkot, C1 medical students. On this channel, I share clear, organized lessons and tips for medical students, nursing and health science students. If you find the video helpful, please like, share and subscribe so we can keep learning together. The content here is educational purpose only. It's not for medical advice. Today we will start our lesson with history taking and physical examination. We will learn how to ask the right question, listen carefully and examine systematically. Everything here is educational, safe and student focused. Subscribe and join me as we can make clinical skills simple and practical. So let's dive to real medicine, learning through patient's history and physical examination. But we have to understand this that 70% of the diagnosis can be made by history taking only, and 90% of it is based on both the history taking and the physical examination. So be well organized. The objective of me presenting this course is to take history from the patient and perform systemic physical examination by taking comprehensive patient's history and applying physical examination techniques and identify the normal and the abnormal findings. Components of taking comprehensive physical examinations are general appearance of the patients, vital sign and anthropometry, HNT abbreviation for the head, ear, eye, nose and throat history, lymphoglandular system history, respiratory, cardiovascular, abdominal, genitourinary system history, the musculoskeletal system, integumentary system, and CNS. On taking history as an interviewer, greet the patient's will, introduce yourself, your position, and ask for his willingness to give the information. After taking skillful notes, thanks the patient for being cooperative for your work. While taking history, we properly have to write down the date of the clerking, the time and the ward that the patient is admitted. Then we will go to the identification of the patients. We start with the name, the age and the sex. These are called as the unique identification of the patients because they can directly influence the diagnosis and the treatments since there are age-based and sex-based pathologies. On assessing on the address of the patient helps us to identify if there is any kind of environmental or geographical risk factors such as malaria and its endemic areas. It's important for follow-up and also for epidemiological trackings. For example, if a patient reports his address or living in rural areas, indicates that there may be poor sanitation with increased risk of typhoid and parasitic infections. Moving to occupational history of the patients indicates if there is any kind of exposure to occupational hazards like chemical, dust and noises, and also reflects the patient's lifestyle and physical activities. For example, a construction worker with a back pain can suspect a musculoskeletal system strain, and the factory worker can be exposure to toxin and the dusts. Moving to religional history, some beliefs can influence our treatments, like the diet and acceptance of treatments. For example, on a diet, our Muslim patients fasting during Ramadan indicates that we need to adjust the diabetic medications. On accepting treatments, example, blood transfusion in the Jehovah's beliefs is a witness, and for other beliefs there may be a difference in end of life care decisions. Moving on the martial status history of the patients, we need to assess if there is any kind of support system, reproductive history and sexual history, and risk of sexual transmitted infection. For example, in taking history, you may find a married woman with a history of infertility, so we need to assess her spouse history because it's relevant. Moving to the next, if unmarried teenage woman approaches with a pregnancy, she needs a psychosocial support. Moving to educational status of the patients, it determines the health literacy because it can influence how the patients understand their condition and follow our instructions. I organized this slide based on Bates Guide and Physical Examination and History Taking as a reference. It will show you structured history and physical examination performances. So, if you find my video helpful, subscribe to my channel for more weekly videos to make skill simple and practical.